Welcome to today's video. Today we have a diabetic patient who came in for regular routine foot care, and as you can see, she does have a wound that she didn't even know was there. So I'm going to answer a couple of questions that come up from people in the comments sections. One being, why does insurance pay for diabetics to come in and have their toenails, corns, and calluses removed every couple months? And this patient is the perfect example of why they're willing to pay for it. She didn't even know she had a wound, and the fact that we were able to find it before it got very infected is going to help keep her from having to have her toes amputated. The second question that I hear from people a lot is, why don't you just fix the toe that's causing the problem? And as you'll hear in my conversation with the patient, she has been very clear that she doesn't want any more surgery. She's an elderly patient, basically pretty healthy, but she doesn't want any surgery. So we now have to look for options that will fit with what she wants. We have to meet our patients where they are. So she's a very nice lady. It's an interesting toe, and I hope you enjoy our video today. So you're telling me that this toe, where it hits the top of the shoe, is very painful. Now let me ask you, are you using the medicated corn pads on this?
I used it for about probably a total of 4 weeks.
Okay, because what it looks like to me is that there's now an open sore there.
Oh, that's even better.
Yeah, those medicated corn pads, what they are is they're a little disc of salicylic acid.
Right.
And it's meant to burn through the thick skin, but if you use them too much, they'll burn through the good skin and form an open sore. So let's trim that down first.
Okay.
And it's kind of red around there, so is it possible there's a little bit of infection? Yes.
Maybe.
So, okay, so let's trim it and see where we get.
Okay.
Yeah.
I expect to be not comfortable.
Right. So, all right, so this is all just the super wet skin from putting the acid on it, but in the middle of this, you can see there's actually an open sore now on the top of this toe.
Okay.
So what we're going to do, we're going to get an x-ray to make sure that the bone is not involved.
Okay.
I doubt that it is, but given how red this is, I want to make sure that there's no infection in the toe or in the bone. And
well, I should have got here sooner.
well, shoulda, coulda. Don't beat yourself up. You've got.
I can't help myself. I have so many appointments.
Right. You've got bigger things going on right now.
Every time I turn around, there's another appointment, and I don't complain because, you know, I could be gone already. So
yeah,
they're trying hard.
I had a patient when I first started in practice, and I didn't understand it then, but I do now. They said, if it weren't for all my doctor's appointments, I'd have no social life at all.
Oh my goodness. Well, why can I relate to that?
Yeah.
Yeah.
Okay, so what we're going to be doing for the next couple weeks is keeping some antibiotic on this.
Okay.
Pending what I see on the x-ray, I may put you on an oral antibiotic, but we need for this to heal without infection getting inside or down into the bone. So and then I'm going to see you again in a couple weeks just to make sure that that is healed. Okay.
If we don't have to go with an oral, that would be good.
Yes.
I've got a lot of
you've got a
lot of stuff going into my system there.
Okay.
And I can't.
Okay, so let's get these nails trimmed also, and then we'll get you back in every 3 months.
Okay.
And I think you should be fine at 3 months. If not, we can shorten it down to 2 if we have to.
Okay. But first, I'm going to come back in a couple of weeks.
Right, because we need to relook at that wound on this toe here.
Sorry, I couldn't get the polish off.
That's fine.
It's been on for a long time.
No need. I'll get it off with my little sander.
Okay. Meanwhile, your photos are amazing.
Thank you.
Amazing. Were some of these taken in South America?
They were taken in Guatemala.
Guatemala.
Yeah. So it just lets you know when
Look at this.
it starts filming.
Those sheep.
Those were Norwegian sheep, and Norway is known for its wool. And those are this little store where we were. The ladies were actually knitting the products in the back,
Oh, wow.
and those were the sheep that they got their wool from. My daughter said they should put a little tag on each piece with a picture of the sheep that wool came from.
That's cute.
I said, yeah, I don't know that.
That's cute.
Anyway, yeah, so I think we can keep you really comfortable with these nails, getting you in on a regular basis.
Yeah, that's kind of what I was thinking. And then, you know, when my daughter said, have you thought about having some kind of standing appointment? I started to laugh. I said, yes, unfortunately, I have
And
been thinking about that this week.
we do that for a lot of people.
Okay.
We have a lot of people who come in for just regular nail trim so they don't get bad like this.
Well, the first thing we're going to do is get this thing cleared up.
Right.
And then I will make an appointment for a recall appointment and then a standing appointment.
Right.
Is that what I need to do? How far north in Norway were you here?
We were in the Lofoten Islands.
I'm sorry.
Lofoten Islands, so
Okay.
just above the Arctic Circle.
Well,
Um,
I was in Bergen and Oslo, but I didn't.
Yeah.
And then I went up the coast to the first major fjord.
okay.
Yeah, and we sailed down the fjord.
Yeah, those were a little south of where we were. I'm going to put a little Band-Aid on this toe here,
Mm-hmm.
and then we'll get an x-ray and just make sure that the bone is not involved with any infection there.
Okay.
Okay. So we put a corn pad on here to help keep the shoe pressure off, but the last thing that I want to talk to you about with this is that you can, because I know you're not looking to do any more surgeries,
No.
but you can cut an X through the fabric of the shoe right over this. And that will release all the pressure, and it won't look bad like you've cut an old lady hole in your shoe, but it will just relieve all the pressure right over that spot. So I can help you with that today if you want to do it on the shoes that you have today, or we could have you bring in a different pair of shoes that you don't care so much about.
Maybe we'll do that.
Okay.
I live in